Great, I see a lot of us here. Thank you so much for taking our time. So while a lot of other people join in, I think we should get started. So welcome to the webinar on gathering feedback across the patient journey. Today, together, we're going to explore how feedback at every stage of the patient experience can transform healthcare services. I'm Sonika, co-founder and product director at Zonka Feedback. Zonka Feedback is an AI-driven patient and customer feedback platform that helps you measuring patient feedback as well as effectively close the feedback loop. I'm really excited to welcome you guys, and together I'm hoping that we're able to discuss actionable strategies for effective feedback collection and implementation. So let's dive in. So, the purpose of today's webinar is to understand why feedback is the cornerstone of modern healthcare. We're also going to explore how to map feedback collection to the patient journey and actionable ways to close the feedback loop. By the end of this session, I hope that you'll have clear takeaways to effectively implement the feedback program in your facility, or if you already have a feedback program, for you to enhance it further and make it more effective. So here's today's agenda and what we're going to be discussing today, right? The things that we're going to be covering in today's webinar together are going to be the role of feedback in healthcare. The second is how to align feedback with the patient journey. The third thing that we're going to speak about and explore are the channels of feedback, right? There are various ways to take patient feedback. So we're going to explore all of those channels and understand which are ideal channels and where. And then we're also going to talk about strategies of collecting feedback at various stages of the patient journey. And lastly, we're also going to speak about how to act on this feedback to enhance patient care, which I believe is one of the most important things to, implement when you're looking at a feedback program. And of course, we're going to end today's session by doing a question and answer. So any questions that you might have while we're going through the webinar, please note them down, and we're going to talk about them at the end of the session. Let's start with the basics, right? Why is feedback important in healthcare? Why does it matter? Why do you need to take feedback? Now, feedback, while a lot of your team members may think, is not about identifying just issues, right? You're not just taking feedback to identify what's wrong, what can be improved. Feedback is beyond that, right? It's a critical tool for building trust because when you take feedback, you're actually strengthening the patient and provider relationship. Secondly, it's also very important for operational efficiency, right? You identify operational bottlenecks when you're taking feedback, and it helps you to actually become more efficient there. Thirdly, it's very important to also ensure high standards of care. When you take feedback, you understand what's working, what's not working, and you're able to implement those strategies to actually improve the care quality and the satisfaction amongst patients. Moreover, moving beyond that, it's also very important to take feedback because it contributes to your organization's reputation, especially if you're, doing any kind of public reviews, especially through Google, places and so on. So taking feedback helps you improve that reputation as well. And lastly, and one of the most important factors is that it also helps ensure compliance with healthcare standards, whether it's NABH, JCI, or even on the global front, if it's, HIPAA compliance. So that's why it's really, really important and it really matters that you take feedback. So before we dive in further, I'd actually love to know through a simple poll here of how many of you are actually currently taking feedback. So here's a poll that you would see on your screen. Just give me a simple yes and no so we can, get a head count of how many people are actually currently taking feedback. And this feedback could be through any channel, but that you're actively taking feedback and, seeking suggestions from patients. Great. I think let's see the results. Okay, so that's an amazing number. Then 91% of people who are actually taking feedback and a 9% who are not. If you're taking feedback, I really hope that the session helps you improve on that process. If you're not taking feedback, that's even better because you have a lot to learn from the session and then obviously understand strategies of how you can improve it. So thank you so much for participating in the poll and let's move ahead. So now that we know that taking feedback is important, the next step, of course, is to understand the patient journey. Now, the patient journey, of course, in all healthcare organizations, whether it's hospitals or clinics or IVF centers, dental centers, it's always going to be slightly different of how you've set it up, right? But overall, the patient journey consists of four main stages, and all of these stages are very unique, and they're also unique opportunities to gauge patient feedback. So let's dive in and just walk through what the stages are and what the patient is going through when these stages are there, right? So the first stage, of course, is the pre-visit stage. Now, in the pre-visit stage, as a patient, I would basically be researching on, different healthcare providers online, reading reviews, asking my friends and families about healthcare providers, and so on. And let's say I finalized a healthcare provider. It could be based on the proximity of where I am, or it could be based on the reviews that I've received. The next step, of course, for me is to book an appointment. Booking an appointment could happen through a website, it could happen through an app, or even through just making a phone call, right? So that's your pre-visit stage. The next stage is the arrival stage. So as a patient, I've made a booking and now I've reached the healthcare center on the day of my appointment. So in the arrival stage, I'm going to walk into the facility. I'll be checking in at the reception, navigating around. If I have come here for the first time, then obviously I have to go over the patient registration and so on. And once those formalities are done, I will settle in and probably be waiting in the area for my appointment, right? The next stage is the during visit stage, which I've split into two. So one is the OPD, which is the outpatient, and the second is the IPD, which is the inpatient. And while they're both on premises, the experiences for both OPD and IPD can be slightly different. So during the OPD, my interaction is about consultation, it's about diagnosis, about the treatment that I'm about to receive at the hospital. There is a lot of interaction, of course, with the doctor and perhaps also with the nurses. And some key concerns for me as a patient would be, the facility cleanliness or the comfort of the waiting area and so on. Similarly, moving on to the IPD, which is the inpatient, the experiences are going to be slightly different, right? Things that would matter to me are also the room condition, the cleanliness during the stay, also the availability of various services like the food services and other facilities during my stay at the hospital. And also, there's going to be an enhanced interaction with nursing staff, caregivers, doctors, because it's going to be on a frequent basis. And then the last stage is the post visit stage. During the post visit stage, there is recovery and follow up visits that are there, and also all the post care instructions that you've received. So, this is essentially the patient journey that is there. Why it's important for us to map and understand the patient journey is because the feedback that you collect at each journey or the pain points that are there at each journey will be fairly different, right? So, the next step that I want to talk about is the ways of taking feedback, right? Same as the patient journey, like there are various steps to patient journey. Similarly, there are multiple ways to gather feedback, right? And what feedback are you gathering can heavily depend on which part of the journey you're at as a patient. So, the ways of taking feedback are three different types. One is on premises. On premises, I believe, is one of the best ways to take feedback because the patient experience is very relevant, it's very new, it's very fresh. So, emotions can also be a lot more heightened right after, my experience with the doctor. So, it's a great time to take feedback. And this is also where you can actually receive some of the highest response rates when you're taking feedback. So, how do you set up the on premises feedback? So, there are two easy ways that you can do it. One is taking tablets and kiosk feedback. So, you can install Android or iOS devices in key locations, for example, setting it up at the reception or in the waiting areas, etc., so that you're able to capture real time feedback during visits. This could be post discharge, this could be after the appointment is over. And the other way, which has also gained a lot of popularity post COVID, is the QR code feedback. This is less on investment, and you can place QR codes again at strategic locations so that patients can scan and then provide their feedback very conveniently. The next stage is the post visit stage. And there are three main ways in which you can take feedback in the post visit stage. One being SMS surveys, right? SMS surveys are really popular. We use SMS heavily, even when we're doing, our e-commerce shopping, etc. SMSs are used very frequently. So sending your surveys through SMS also becomes a very good way to take feedback. These post-visit surveys are also very important and can be key in your feedback journey, because a lot of times you don't want to take feedback right after the appointment or right after discharge, but after a delay. So the post-visit surveys like SMS, WhatsApp, and email can actually be triggered after a delay, like after an hour or 2 hours or even the next day, right? So there's SMS, there's WhatsApp. WhatsApp, of course, is really popular again. And with Zonka feedback as well, you can leverage WhatsApp surveys. You could have WhatsApp buttons or direct links in the WhatsApp messages itself so that your patients are able to give you feedback. And lastly, are email surveys. So email surveys again are great if you're looking at, taking feedback, sending lengthier surveys, etc. So email surveys can also be triggered and sent to your patients. The next is online feedback. Now, online feedback is more relevant for healthcare organizations that have a mature website or an in app where there is a lot of patient interaction happening. So, for example, you may want to use embedded forms or pop ups in your facility websites to gather feedback on online services like appointment booking and so on. Similarly, if you have a website or an application where you're doing any kind of teleconsultation or online consultations, etc., or you have any kind of digital services that you're offering to patients, then in-app feedback also becomes a very interesting way to take feedback. With tools like Zonka Feedback, you can take feedback across multiple channels, and this can very easily be set up. It could be through email, through SMS, kiosks, in app, website. All of these can be very easily set up when you use a tool to take feedback. Now, before we move ahead, I'd love to know, a lot of you said that you guys are taking feedback. So I'd love to know through a simple poll, or what are the channels of feedback that you're currently using. So just answer the simple poll on your screen that's going to appear right now, and let us know what are the channels you're using to take feedback. If you're using multiple channels, just pick the one maybe that you're using the most. Fantastic. Should we see the results if you guys have all answered? Great. So about 33% are taking paper feedback, which is great. There is a lot of opportunity for you to digitize, but the important thing is that you're taking feedback. Tablets and kiosks are really popular. I'm surprised about that. That's equally same as paper feedback. I think tablets and kiosks again are great because they're on-prem and you're able to take feedback from patients while they're there. So that's very interesting. Post-visit phone calls, of course, are really popular as well. Great. There's less of email surveys. So maybe towards the end of the session, we can explore why there are lesser email surveys, because they're also great opportunities to take feedback. Great. Thank you so much. Thank you so much for answering this. And let's move ahead with the webinar. So, in the next stage, right, what I want to explore is the two things that we discussed previously. One, the stage, the patient stage or the patient journey. And of course, what are the strategies that you can set up for taking feedback there? What should it be ideal for? What are the goals you need to have during that stage? What are the ideal channels to take feedback? And then what are the best practices that are there? So we'll start with the pre-visit feedback. Now, during the pre-visit feedback, your feedback, of course, focuses on the ease of booking or the clarity of information that is there. So it's ideal for hospitals and clinics that have an advanced booking system or apps to, manage appointments, etc. And it's also ideal for the healthcare facilities that want to optimize their communication and website experience. The goals when you're setting up a feedback program for a pre-visit feedback should be one, of course, to ensure a very seamless booking process. The second is to identify any communication gaps, right? If you have an appointment set up online or you're doing any kind of teleconsultations, etc., you want to make sure all your doctor information is available. Similarly, let's say I'm booking a lab, a lab test, etc. Are all the preconditions mentioned there, etc.? So it's very important for me to be able to identify the communication there. Now, what are the channels that are interesting in this particular stage? One is you can definitely set up a website or an in-app feedback form. So, have it right away on the website or the in-app itself. The second is to have automated SMS or WhatsApp right after the booking, right? So these are two interesting channels that you can set up in the pre-visit stage. Now, what are the best practices and the setup tips that are there? One, definitely integrate this very closely with your website so that everything is automated, right? Once somebody has done an online booking, you can't manually be sending these surveys. So you want them to go automatically. The second, which I think is relevant for all the stages that we're going to speak about, is that it should be integrated with your HIMS systems. So that you're actually able to track issues that are there. Third is using logic-based forms to investigate unhappy experiences. If I've had a good booking experience or I've had a good consultation, etc., you may not want to ask further questions and bore the patients. But if somebody's had a bad experience or they have some complaints, you could have follow-up questions to investigate unhappy experiences. The next is, of course, to set up real-time alerts for any errors or issues that are there so that it can be routed to the right team members, right? So these are all the pre-visit stages. Okay, let's also explore some of the pre-visit questions which are there. Of course, in the pre-visit, like I mentioned earlier, use short and automated surveys with like one or two questions only. So some of the questions that you can easily set up are one, was the website or app information clear? So this could be a simple yes and no. Similarly, after an appointment, you could have a WhatsApp or an SMS survey that asks about the ease of booking the appointment. Right? So pre-visit surveys, keep them short, keep them automated, and have them very well integrated with your website and apps. Great, let's move on to the next stage, which is the patient's arrival. So now the patient has arrived at the hospital, they're exploring the facility, doing registration and everything. So here it is critical to identify any delays and bottlenecks that might be there. Right. Now, this is ideal for different healthcare organizations. I mean, all healthcare organizations, actually, it could be hospitals, clinic, IVF centers, dental centers, and so on. And it's also relevant where you have like a patient waiting area and you want to gauge, the waiting time, facility feedback, and so on. The goals in this particular stage should be about improving efficiency and reducing the waiting time as much as possible. And the second is, of course, to identify bottlenecks in the arrival process. Now, one of the most popular ways of taking feedback that we also saw in the poll is paper feedback form, right? Because it's easy and it's great that you have that set up, but we want you to go digital. We want you to make sure that these processes are automated, they're reaching the right team members immediately. And when you go digital, these are the two channels that I recommend you could set up in the arrival stage. One is kiosks and tablets at the reception. They're very easy to set up, and they make sure that your patients have an easy access, right? That they know there is a tablet, and as an healthcare organization, you're also caring about patient feedback. Looks great as well, I believe. And the second, of course, is the QR codes in the waiting areas. Again, QR codes are super simple. We're all using our phones all the time. So patients, while they're waiting, could just easily scan and give feedback right away. Now, here are some of the best practices when you're setting up the patient arrivals feedback, right? One, again, use quick and easy, user friendly surveys. I think I'm going to speak about that quite often, that you should use very quick and easy surveys because everybody likes giving feedback that's really relevant. But yes, emphasizing it at each stage as well. The second is to set up alerts for excessive waiting time. So if I've scanned a QR code as a patient and I've said, it's frustrating, I'm waiting for a very long time, it should reach the right people in your organization so that they can address the issue while the patient is still on premises, right? The third is to link these feedback tools to your patient management system, right? Again, you want to identify which patient was miffed because of having any delays. And the fourth very important stage here is to regularly review this to streamline process. So when you regularly look at, the cumulative feedback, there are a lot of patterns that you will start identifying. Like, are there specific times, mornings and evenings, when, of course, people are more frustrated because of the, time? Similarly, are there specific days when there are further delays? And it could be for various reasons. It could be, of course, the rush hours and so on. But there are then, based on this, things that you can implement. For example, when you send a confirmation to the patient, you can let them know beforehand that, there's going to be a waiting time of 45 minutes. So that mentally, as a patient, when I arrive at the facility, I'm prepared that there's going to be, a waiting time and I'll have to be here a little longer than usual. So that's the patient arrivals feedback strategy. Now, let's look at some of the questions that you can ask during this stage. So again, user-friendly surveys, use CSAT questions or smiley faces or stars a lot so that they're quick questions that you can ask patients while they're there, right? So your questions could be, how would you rate the check-in process? Or actually asking them how much waiting time was there for the appointment, whether it was 5 to 10 minutes, more than 30 minutes, an hour, or more than an hour. So you actually hear from the patient about how much time did they have to wait after they walked into the facility. And you can also investigate further about how helpful the staff was at the reception. Right? There are a lot of times patients have a lot of questions they ask, and you want your staff members to be helpful, especially because this is times when, a lot of patients are stressed, they're not sure. So these are questions that you can have in the arrival stage. Let's go to the next step, which is the during visit. Now, the patient is now interacting with the doctor. So the OPD feedback, centers a lot around the doctor-patient interaction. And during the OPD, actually, when you're taking feedback, you can gain insights into both operational as well as, clinical experiences that the patients have had. So, of course, this is ideal for any healthcare organization that has an outpatient department, even specialty clinics, etc. And this is also ideal where there are multi-doctor facilities and clinics available. Now, the goals during this stage, when you're setting up your OPD feedback, should be one, to assess patient satisfaction with the consultations, right? That's the main interaction that the patient is having. So you obviously want to know how well is that going. The second is to identify if there are any issues which are related to patient comfort. Are they comfortable? Did they have a smooth and seamless experience or not? And the third goal, which I think is very important, is also to take doctor based feedback, right? To identify, and so if you have multiple doctors in the healthcare facility, it will always be interesting for you to look at, how satisfied are different patients with particular doctors, right? The channels again are one, paper feedback, very popular. I think that's used heavily, but we want you to switch from that and move to more digital channels. So, one, setting up tablets and kiosks in waiting rooms and receptions. Two, setting up and sending SMS and WhatsApp feedback post the appointment, right? So, you can set this up post appointment as well. And some of the best practices here are, you definitely link the doctor who consulted with the feedback. So when you're taking patient feedback, link the doctor's name as well. Second, enable alerts for low score. So as soon as there's a low feedback, enable alerts so that your team gets notified immediately. Third, monitor and improve patient and doctor relationship using that particular feedback. And fourth, like we did in the previous stage, integrate this data into performance review. So when you're reviewing performance, you're able to integrate that very easily, right? So these are things that you can definitely look at. I think in the chat, Srinivas also mentioned an interesting point that we must also look at receiving feedback from patients about ease of access to the hospitals and the reason for choosing a particular unit, brand, and doctor. I think that's a great point, and that's something that you can definitely use in the arrival stage, because that absolutely depends on what are your goals for taking feedback. um, However, I would definitely recommend that when you're taking feedback on factors like these, for example, the ease of feedback to the hospital, right? You should also look at being ready for the kind of options that may come. So, for example, in ease of access, let's say somebody was not finding it easy, maybe sending directions, letting them know how to reach the hospital, etc., would be interesting, right? And the reasons for choosing a particular unit, brand, or doctor, or how did you hear about us, also lets your team know what are the areas that they should focus on, how they can basically promote that better, right? uh, Great. I have another question from Srinivas about for sending SMS, the DND issue from Try creates a lot of restrictions. So, any way to address the same? WhatsApp is trending. Absolutely, WhatsApp is trending. At Zonka Feedback, we've recently released WhatsApp surveys, and we've had a lot of healthcare organizations jump into it right away and started WhatsApp. SMS also is actually still quite popular. What happens with SMS is that in India, you have to get all your templates approved. So we work very closely with, SMS vendors to get those templates approved. As well as because these are not marketing messages, they do manage to get received by patients as well. However, I would still recommend if you're choosing between WhatsApp and SMS, WhatsApp will definitely do much better because as patients, as customers, we're also using WhatsApp more and more. So that's why if you see everywhere in all the channels, I've mentioned both WhatsApp and SMS. You could be using both of these as well, right? And another interesting thing that you can do with tools like Zonka Feedback, if you have a feedback management tool, is to try both, right? Don't take a decision based on what we think. You could actually try both, set up both. Let's say, send half your patients SMS surveys and half of them WhatsApp surveys and see where are you getting better response rate. Similarly, you could do this for like a couple of weeks, right? Set up 2-3 weeks of SMS surveys and then switch to WhatsApp surveys. So before you make your decision, use tools that allow you to do that extensively and then decide what is working for you, right? Another important thing when you're using tools to do it is that you don't have to stick to one channel. You could start with SMS, and then if you think it's not working for you, switch anytime later, right? So that's why keep your feedback program really agile. Look at it on a daily basis or a weekly basis, evaluate what's working, and then change what's not working right away. Right? That's the benefit of taking this more proactively. Great. So coming back to the OPD feedback strategies, I want to just show you a couple of questions that you can use in the OPD feedback as well. So again, in the OPD surveys, I would recommend again keeping the surveys very brief, to the point, so that you're also respecting your patient's time, right? I've just finished an appointment or I've just been discharged. I don't want to answer lengthy surveys as a patient, right? You wouldn't want to answer them as well. So make sure your surveys in the OPD are again very, very brief and they're very to the point. So some questions that you could ask is, of course, about the overall interaction with the doctor. Use smiley faces, use stars, so that it's also, nice for the patient to reply. It's easy for the patient to reply as well. The second kind of questions you could ask are about whether the concerns were adequately addressed by the doctor. During OPD specifically, it's very important for us as a patient to be able to speak to the doctor, to, put our concerns in as much detail as possible. So, understanding whether concerns were addressed adequately or not becomes very, very important as well. So, these are some of the questions that you can ask during the OPD feedback. Okay, now here are some interesting reports that I want to show you from Zonka Feedback. So, in my previous slide, I mentioned that you should link your doctor to the feedback that you're getting. So when you do that with tools like Zonka Feedback, you'll also be able to see how well the doctors are performing and what is the sentiment that your patients have for each doctor. So if you add all your doctors and start linking your feedback to them, you'll be able to see how many feedbacks has each doctor received, what is my satisfaction for each doctor, and you'll also be able to see which doctors are doing well, how the scores are changing over a period of time. So you're actually able to get and understand the top performers that are there. So very interesting when you link your OPD feedback with the doctors to get real-time insights there. Great. So next, let's move on to during visit IPD feedback strategies, right? For IPD, of course, the continuous monitoring and real-time alerts become very, very crucial, right? Because the patients are now on premises, they're staying there, their family members would be visiting again and again. So having a continuous flow of feedback is important. You just don't want to set up a discharge feedback that how was your overall experience? You have opportunities of improving feedback while they are there in the hospital. So leverage that really, really well. Of course, this is ideal for all admitted patients, and it's also, relevant for healthcare facilities where there's long-term or overnight stays available. Now, the goals during this are one, you should monitor the patient feedback during the stay. So, are they comfortable? Do they have everything that they want? And, all of those. Second is to address issues like cleanliness or staff attentiveness. Again, an ongoing thing that you can address. The third is to identify issues in process and billing, right? So these are all the factors that you can do. Now, what about channels, right? What are the channels that you should use during IPD? Now, here's a very interesting suggestion that I have. If you're setting up IPD feedback and you want continuous monitoring, what happens generally right now is that you'll have somebody on the floor who goes and asks everything okay or not, and so on. And a lot of feedback might be getting lost there, right? So what you can do very interestingly is set up in-room QR code surveys, right? This is something that we recommend and we suggest all healthcare organizations that we work with. It's a very easy thing to do. Set up QR codes in the room. The patient, visitors to the patient, families of the patient can easily scan these and give real-time feedback. This is a great way for you to actually improve ongoing feedback, right? Monitoring everything continuously. So in-room feedback, definitely something that we recommend. Set it up with QR codes. It's low cost, it's easy, and it'll let patients have a voice without actually having to speak to anyone. The second important thing that you can do is, of course, emails or WhatsApp or SMS surveys after discharge. So after the patient has been discharged, you could send email, WhatsApp, and SMS surveys to patients and their families to gauge how the experience was overall, right? Some of the best practices and setup tips for the IPD feedback are one, enabling real-time alerts. Because you're taking in-room feedback, you obviously want real-time alerts to happen. So if patients have any issues with cleanliness or comfort, it's something that can be addressed right away. The second is to connect this with your housekeeping and your nursing teams as well. Now, once the feedback comes, and let's say the patient's saying my room was not cleaned properly, I'm having issues with housekeeping, the food is not good, etc., etc. You don't want it to reach a department and then reach somebody else, and then they reach out to the housekeeping team and so on, right? The purpose of real time gets lost there. So connect this to your housekeeping and nursing teams, the people who are actually responsible for taking action, so that they can address it right away while they're still there, right? Now, ensure that there's continuous flow of feedback that's coming in. So do your periodic check-ins, etc. And again, like we did in OPD and arrivals, regularly analyze this. So there are two factors to all feedbacks, right? One, the real time feedback that's coming in. So you're looking at individual feedbacks. The two is to look at these on a weekly or monthly basis to understand and identify what are the recurring issues that are happening, so that you can bring these in the processes as well. Great. So here are some of the questions that you can ask during the IPD, right? One, of course, asking about how comfortable the room is, how's the cleanliness, etc. The second is, were the doctors clear in explaining the treatment plan and everything that's going on? And the third, of course, is also to take NPS feedback, which is the likelihood of recommending, right? Are inpatients going to be recommending you to their friends and families as well? This becomes very, very important as well. Great. Before I move in, I've just checked the chat. So Srinivas has mentioned that what they've been observing, that areas from where patients originate predominantly influences the channels. Absolutely, I think you're absolutely right. Tier two, tier three cities are more leaning towards SMS still, and that's absolutely right. We also work with a lot of healthcare organizations which are non-profit, and their patients are not using WhatsApps or email surveys as well, and their SMSs and tablet feedbacks are a big hit. Tablet because then patients can give feedback while they're still on premises, and SMS because those are readily used. So I think I absolutely resonate with what you're saying, and we've observed that as well. That there's a lot of SMS feedback that's used in tier two and tier three cities, and they don't necessarily need to move to WhatsApp at the moment. Great. Let's move on to the next, which is the post-visit feedback strategies. Now, post-visit feedback is, of course, an opportunity for you to assess the entire patient experience, right? So this is relevant for hospitals and clinics and healthcare providers that are conducting follow-ups post-discharge, or consultations that happen afterwards. Now, the goal here is to understand the complete patient experience, and then, of course, to address any unresolved issues that are there very, very proactively. The channels here, because your patients are not on premises, are WhatsApp, SMS, and email surveys, right? Again, very popular, and resonating with what Srinivas said, use them based on where your patients are and what do you think they're going to use more. Another interesting channel here is to take online review, if is to send online review invitations for positive feedbacks. Right. The best practices here are to time your surveys very, very strategically. You don't want to take post-visit feedbacks right away. You may want to send them 24 or 48 hours later, even a week later sometimes, based on the kind of, post-discharge in instructions that the patient has received. The second, again, is to use these integrations, to follow up and make sure that your feedback is actually driving action that's there. The third is to have automated follow-ups and workflows for negative feedback. So as soon as there's negative feedback, you want an issue to get escalated. However, during post-visit, it's also important to not miss out on the positive feedback. So you can leverage the positive feedback for marketing and for patient testimonials. So sending a short message to your happy patient saying, hey, thank you for your kind words. Why don't you give us a review on Google, so that you actually get patient testimonials as well. Right, here are some post-visit feedback questions that you can have. So during post-visit, definitely use NPS surveys to measure loyalty and also to understand how clear the post-care instructions were. So NPS, I definitely recommend, because that helps you understand who are your patients who are likely to recommend you to their friends and their family. Great. So now that we have looked at all the different stages and what should be the goals, ideal channels to use, the best practices to use these, let's move on to understanding how to set up an efficient feedback program, right? You may know all of this information, but it's important to now set up the program. And I know that when we talk about setting up the program, a lot of organizations feel there's a lot of effort to do. But that's why I want to break it down in 4 simple steps for you, right? These simple steps can help you actually get started very, very easily. And this is going to resonate with a lot of things that we've already spoken about. So, the first step is to choose the right surveys. What is it that you want to ask? What is the goal of your survey? Make sure that you're tailoring your surveys for every step of the patient journey, right? You can't ask the same questions. How was your experience at every stage? Tailor your questions, understand what questions you want to ask. Even though I've recommended having very, very short surveys, it's important for those surveys to be very targeted. So keep your surveys very relevant, very actionable. Understand how you would like to give a survey, right? You want to answer questions that are relevant to you about things that you have used, the doctors that you've spoken to, and so on. So make sure your surveys are very relevant, very actionable. Use logic in your surveys. Even use multilingual surveys. Speak to the patients in the language that they speak so that they're very relevant. The second is to use the right channels. So we've spoken about this multiple times now, but use a multi-channel approach. Don't stick to one channel, right? You don't have to commit to one channel. Keep changing the channel for different types of surveys, see what's working well, and use the right channel there. And secondly, understand where your patients are most active. So, like we discussed, if your patients are not very tech friendly, you think they're not going to be using emails too much, then stick to QR codes, stick to SMSs, stick to tablet based feedback, etc. If you think QR codes is also too much, you don't see that your patients are going to be scanning QR codes, etc., then skip that, right? Use tablets, take more on premises feedback. So the idea is not to give up on taking feedback. I see a lot of healthcare organizations that we work with. They're like, they try one channel, they see, oh, we're not getting enough feedback. Maybe this is not working for us. So this is where you need to experiment a little bit and choosing the right questions and then choosing the right channels, right? The solution is not to give up on setting up the program, but to actually set it up more effectively, right? The third step is integration. Now, nothing works well in isolation. If you set up a program and it's not talking to everything else in your system, it is bound to fail, right? So, systems should talk to each other. You already have an HIMS system. If you don't have a formal HIMS system, you will definitely still have a way that you're maintaining all your patient data. Make sure that that integrates very, very well with whichever platform you pick, right? Because that is where the actual efficiency and effectiveness comes. Now, your integration to the system should be two ways. One, it should be about automatically triggering surveys. So after an appointment is booked, after an appointment has happened, after a discharge, at all of these touch points, it's important for the surveys to get automatically triggered. And similarly, the data should get synced back into the system as well. So set up your feedback program very efficiently by integration. The fourth important thing is to automate. Now, you don't want to bring in a system where your team has to do a lot more hard work now and they have a lot more things to do, right? You already have a team that's busy, so make sure that you're picking up a system that does a lot of automation for you. Whether that is automation to triggering low satisfaction scores to your right team members, or even automation for sending Google review requests, right? Make sure that all of that is automated as well. Great. So now that we've set up the system, I want to get to the part that is most most dear to me, which is about closing the feedback loop. Right? Any feedback system that you set up, it's very, very important for you to also close the feedback loop. If you're taking feedback and you're not doing anything about it, you're actually going to frustrate the patient more, right? It's like talking to a friend and a friend sharing with you that, I'm upset, I have this issue and all, and you're just walking away, right? You don't want to do that. So you don't want to do that with your patients as well. You want to take feedback and then you want to act on it so that your patients know you actually care, and also that it's actually having an impact on your business. So there are 4 easy steps to close the feedback loop. And I recommend that when you're setting up your feedback program, this is something that you define from the get-go itself. So one is acknowledging feedback, right? Somebody comes and shares a concern with you. You let them know, I've heard you, right? So promptly send them a message saying your concerns have been heard and there will be action taken on it. So make sure you acknowledge feedback. The second is to take effective action. So whether it's positive feedback or it's negative feedback, you want to take some effective action on it. So There's negative feedback, make sure you're looping in the right team members and there is action that's being taken. The third is communicating changes. Now, it's not enough that somebody complained and you made an action, but you didn't communicate it either with your team effectively or with your patients as well. So make sure that you're also communicating those changes. You're sharing the action plans with patients, you're sharing it with your teams as well. So your teams also know that you are patient centric and you really care about patient feedback and making improvements based on that. And the fourth is to build patient loyalty. One of the very good things about taking patient feedback is to also recognize who are your happy patients and then leveraging their reviews on Google, featuring them on test as testimonials, etc., on your website and showing them online. Right. So make sure that you also set up this very simple four-step process to actually close the feedback loop as well. And now I want to come and take a minute to just introduce Zonka Feedback to you and how we help you do everything that we've spoken about very, very easily, very, very effectively. So Zonka Feedback, as I mentioned earlier, is an AI-driven patient feedback platform, right? Now, we here try and tie both human and technology together, right? So, we basically empower your team to listen to feedback, to act on feedback, and to improve on patient experiences through a very comprehensive patient experience platform. So, you see the circle of the flywheel, that's listen, act, and improve on patient feedback. But we don't want you to do that manually. We want you to leverage technology to do that very, very intelligently. So if you see the inside of the flywheel, it talks about three technology aspects that you can use to do this very effectively. One, to use intelligent automation, which is powered by AI, to have workflows set up, to do seamless integration, all of this together leading to delighted patients. So you use the human and the tech to actually have happier patients. Before we move on further, I'd actually love to pause and understand how many of you currently are closing the feedback loop. You're taking feedback. We've also explored the channels you're using to take feedback, but we'd also love to know how many of you are actually closing the feedback loop. So let's take a moment and then answer this poll as well. So just a simple question, that is your healthcare organization currently implementing CAPA, which is corrective actions and preventive actions, in your patient feedback process? Reena, Meenakshi, that's great to hear that you guys have a CAPA system set up in your organization. Great, let's see the poll results and see how many of you have the CAPA set up. Oh, that's great. That's 75% that have CAPA set up and 25 that don't. So that's really good numbers. That's really good to know that you are taking feedback as well as you're also doing corrective and preventive actions. I think these are also required by compliance. So NABH also requires you to have CAPA set up. And at Zonka Feedback, we help you do that very easily and very effectively as well. Great. I also just want to quickly show you a few slides about Zonka Feedback and how you're able to take feedback through it. So, of course, you're able to customize questions. We went over a ton of different questions. So, your questions, of course, can be customized. At the same time, you're able to look at real-time reports in the platform itself. And if you're a multi-location setup, right? You can set up all your locations and look at your feedback across those multiple locations as well. So when you're picking up a tool, make sure that these are things that are readily and easily available to you. You want to be able to compare locations, you want to be able to look at doctor feedback, you want to be able to customize your questions, etc. as well. So make sure that when you're looking at a tool, it is NABH compliant and it also takes in all the kind of customizations that you may need to set it up easily. Great. So, thank you so much for staying on and being very, very participative in both the polls and the chat. At break, for any Q&A that you have, any questions that you have, just drop them in the chat, and I'd be happy to discuss those with you. Mhm. Okay, I see a lot of questions about the best time to send a post-visit feedback survey. Ideally, the best time to send a post-visit survey would be after about 2 to 3 hours. So sometime between maybe 4 to 6 hours, you could send the OPD survey. Some people also tend to send it immediately, but I feel like a little delay would be ideal to sort of send it. So definitely, time your surveys in a way that, it gives a little bit of gap to the patient. They, reach back and they're able to sort of absorb the experiences they've had and then give feedback there. Another question that we have from Diksha about how can healthcare providers increase feedback response rates? So, increasing feedback response rates, when you map your journey very, very effectively, you automatically tend to improve your response rates, right? What is the right time? Are you sending the right surveys at that time? So that becomes really important. And the channels of the feedback as well. Right. So definitely look at the channels of the feedback, and whatever channels you're using, there are effective ways to do that as well. For example, if you're doing email surveys, you could embed the first question of the survey within the email body itself. Right. So those are things that you can look at to sort of increase your feedback response rate. The message that you're sending, are you letting the patient know that we care about your experience and your feedback would help us get better. Also include maybe the time that this survey is going to take you, just a minute or so to take, so that they're participating more in the feedback. Right. Ankit's also asked us in chat that is there an AI app for taking the best feedback? Definitely, there are a lot of apps which are available. So Zonka Feedback being one of them, you're able to connect Zonka Feedback to your HIMS systems and take feedback automatically. So you can set up your OPD and IPD surveys. You can set up multiple channels, and it is also AI powered. So once your feedback starts coming in, you're able to identify patient sentiment, um, the urgency of the feedback. You're able to look at AI based reports as well, so that you're able to effectively understand and take action on that particular feedback. Anthony has asked, what specific improvements or changes would you suggest to enhance your overall experience with our services? So I think the improvements and the changes that you can do should come a lot from the patients itself, right? Use open-ended questions to understand what the expectations of your patients are, and then work on those very effectively, right? One is, of course, I mean, patients could have all kinds of expectations, right? The second is, like, one is you can set those expectations right. Like I mentioned in the beginning when it was about the waiting time, right? You could, in your booking time itself, mention that there's generally a 30-minute wait and so on. So setting those expectations right is very important from the get-go. And then, of course, understanding what is it that patients want. So when you understand what patients want, you're able to look at cumulative feedback. Those will become very interesting for you to look at what you can do to improve the services. Okay. Okay, we've also got another question from Swati about how does one avoid awkward situations when sending IPD feedback, especially for critically ill patients who get discharged and don't know about their life expectancy. Now, this is actually a very sensitive time to take feedback, right? But also an important time to take feedback, especially if that is the kind of healthcare organization that you have, where you have critically ill patients or patients that have, long-term illnesses, etc. Now, in these particular stages, One very important factor is to frame your questions well. So, you don't want to frame your questions with smiley faces and stars, but be more sensitive about the kind of question that you're asking. Maybe also consider taking feedback from the families and the caregivers that are there, right? Whether they're satisfied with the kind of care that they received, have they received enough post discharge information, and so on. So it's very important when you're taking feedback from people who have long term illnesses, that your questions are framed very well. They're very polite. They're not, your smiley faces and stars and everything. They're not about recommending the healthcare organization, but they're more focused about whether the care that was received, whether the instructions that were received were up to the mark. Use more open ended questions and so on as well. Okay, Ankit's also mentioned about improving feedback, like reducing the waiting time. So how can we improve feedback like reducing waiting time? So again, very exactly what I said. A, setting the expectations right. If you have rush hours, set the expectations right that there is going to be waiting time. I, as a patient, might just carry my laptop or carry a book so that I'm not frustrated while I'm waiting, and I know that this was communicated beforehand. Secondly, when you're looking at cumulative feedback, you'll also understand, what are the hours where there is more waiting time. Can you spread that out further? Can you discuss with the doctors? Can you discuss with the facility and maybe change the timings a little bit, right? Or maybe give, in your booking time, maybe give longer hours, like, for example, instead of just a 15-minute consultation, give a 30-minute consultation time period, and so on. So definitely use the feedback to help improve that, right? And then communicate that to your patients as well. Great, very, very interesting questions. I hope I'm able to answer some of them effectively, and this actually helps you on improving the way you've set up your feedback program. Okay, another question that we have is, can feedback tool help improve reviews on Google? Definitely, when you're setting up your feedback program, and I think we spoke about it multiple times, you can set up automation. For example, in Zonka Feedback, we have a simple redirection that's set up that if people have had a good experience, you can redirect them to your Google reviews, right? And if you're a multi-location setup, you could redirect them to the right location Google. My business page as well, so that your patients can give you feedback right away. So definitely, when you set up a feedback tool, make sure that's something that you look for as well, that it helps you leverage, it helps you track Google reviews as well, because that also becomes very important for you to get new patients. Thanks, Sakshi. You've asked a question about how to effectively handle negative reviews. So again, we spoke about this when we spoke about how to set it up. So definitely, one, set up an automation. So as soon as there is a negative feedback, let your patient know immediately that we've noted your feedback and we're going to get back to you within an expected time. That time could be 24 hours or 48 hours, whatever time you have set up for somebody in your team to call them up or to email them. Communicate that immediately. Then, of course, take internal action. What is the internal action? What is the investigation that you need to do? And then, whatever investigation is done, communicate that again to the patient. So, make sure that there is communication happening, right? Bad experiences can happen anywhere, as a customer, as a patient. But I want to keep coming back to an organization or to a healthcare organization where I know that I'm being heard. So, it's very important to make sure that there's action taken, and that action is also communicated to the patient effectively. That will actually build more trust in the organization, right? As a patient, if I know that my issues were addressed, I'm likely to come back there more and more. Great. I think we've reached the end of the webinar. Thank you so much for staying on. It was a great session. Thank you for being so participative and taking our time for joining. If you have any questions, just reach out to us at hello@zonkafeedback.com. Our phone number and website is also here. We really hope that you found the webinar well helpful, and just feel free to reach out to us if there are any questions that you have. Thank you. Thank you so much for joining.